Hello, welcome to the Freedom from Anger podcast. It's been a while since we recorded something, so we thought we would pick a topic that could help a lot of people. And the topic for today is there a connection between emotion management, such as anger and stress management, and alcohol and drug abuse? And with me is Mr. Jonathan's. He is co-founder of Freedom from Anger. He is currently in the addiction field working on a daily basis. So I thought I would have him as a co-host slash guest and ask him a couple of questions.
It has been a while since we've actually done anything. Definitely since we posted anything on.
Yeah. Been a busy few months, to say the least. A lot of stuff going on in life. So
Yeah, professionally, personally, all kinds of stuff. I
yeah,
agree.
lot of changes for 2023. Okay, so let's go ahead and get to it. So my first question for Mr. Jonathan is, do you think there is a connection between our behavioral health, such as our ability to manage things like anger and stress, and alcohol and drug abuse?
Most definitely, without a doubt. When we do treatment plans for the guys where I work, like the first problem area we identify and touch on is like addiction specific, like we're going to focus on abstinence, and it might be stated as the person continues to use despite negative consequences, and a list of different type of negative consequences. That's just one example. But then we always have a second thing that we work on, which usually has to do with triggers for use or other types of issues that are related to the addiction, but not necessarily directly caused by it, although they can be made worse by it. So a lot of it is things like anger, grief, loss, relationship problems. So we focus on that aspect of it as well because they are directly connected. I mean, there is a connection between all those types of things I just named and the reasons why people use and the triggers for use. And emotions are definitely high on that list that where people get triggered.
Yeah, I would definitely agree. I know just our many years of working with individuals, whether it be alcohol and drug or people struggling with domestic violence issues, anger management, and there's seemed to always be that kind of underlying smoldering anger in everybody. And the inability to regulate emotions is typically very visible, to say the
Yeah.
least.
Yeah. Particularly in the environments that we usually work in, you can definitely, it's right below the surface for a lot of guys, pretty much on a regular basis.
I came across a workbook that I've used in the past doing alcohol and drug treatment is from SAMHSA, or however you want to pronounce it, but it's
Yeah.
the Substance Abuse and Mental Health Services Administration. They actually have a anger management workbook, and I was digging around in that and came across some interesting things. So it says a study was done by Walzer, Deffenbacher, and Shahala in 2015. It illustrates the usefulness of anger management treatments for individuals with substance use disorders. They conducted a randomized controlled trial comparing a 12-session alcohol adapted anger management treatment similar to the one in the manual with a 12-step facilitation treatment. The anger management treatment focused on monitoring cues to anger arousal, relaxation training, and cognitive restructuring. Participants were encouraged to use these anger management strategies to cope with anger-related events that could increase the risk of alcohol use or relapse. Participants in both conditions decreased their levels of anger, but in the anger management treatment condition, people who lowered their levels of anger were less likely to experience negative alcohol-related consequences, such as taking foolish risks or damaging a friendship or close relationship.
Yeah, makes a good point. It shows there is some effectiveness there. If you talk to the guys, and we've been doing this for a while now, and if you work with the guys that we're used to working with on a daily basis, their emotions for the majority of them, I would say a large majority, I mean, way over 50% of them, anger and control of other emotions is a primary factor in their use. And it makes sense that, hey, if I'm angry and I use to deal with it, if I'm already angry, when I use, the consequences might be worse. I don't make the best decisions when I'm under the influence. And if I was angry before I even got intoxicated, then there's a pretty good chance that I might make some pretty damaging choices. And I think we see that a lot.
Yeah, and I think it's important to, for everybody to learn ways to cope with, life, everyday situations. I know me and you both are big on the cognitive behavioral stuff, the restructuring of our thoughts, because if we don't change the way we think and the way we view things, then our bad habits and good habits are kind of open for good times and bad times. So we have to be able to focus on, okay, how am I viewing this situation? I don't like it, so rather than try to escaping, because that's essentially what we're doing when we're using alcohol and drugs, we're trying to escape from reality. This makes
Mhm.
me feel good for this period of time. To heck with the consequences. I'll worry about that when I sober up.
Right. Yeah. I mean, it is used to cope. People use substances in a way, it's what they learned as a coping mechanism. But I think the way we approach it is that you're not avoiding is not really coping, but it has worked for them this far. But if it was really, really effective, I wouldn't be working with them, particularly where I do. So yeah, coping skills are huge. I work with incarcerated individuals, so it's a different ballgame, and that is where the vast majority of my experience is. But I do know, for instance, we've had conversations about things that you and I might assume everybody knows. A lot of people don't know, particularly in that environment, and depending on what their family history is and what their life experiences are, they may not know any other coping strategies or ways of coping other than substance use. So a lot of things there in that environment, a lot of it is education, educating people to the idea that they're not powerless. If that makes sense, because a lot of these guys just feel like they don't know what to do, or they don't feel like they can do anything to cope other than you. So you're starting at a pretty challenging point for someone with some of these.
Oh, yeah, yeah, definitely. We definitely take for granted common sense these days. Like you said, what we think that everybody should know, which, that's one of those key words, should, but reality is, a lot of people don't know.
No, they don't.
Yeah, and
And
because
it's
we don't.
just a lack of exposure. It's not a lack of the ability to pick it up. They just haven't been exposed to it. They're not aware. So I think I don't know about you. I know we've been doing this for a pretty good while, so I think I know what your answer to be. Most of the people that I've worked with that are incarcerated are pretty sharp. I mean, there's not a lack of an ability to pick up things. I think I've probably worked with some people whose IQs are up there higher than mine, and the average person in there is pretty sharp. They can pick up stuff. They just haven't been exposed to it. So I don't. I think there's a. I think that's where you can have a lot of success is through teaching coping skills. That educational part of it makes them just increases their awareness that there are things they can do.
Yeah, that's what I like about the curriculum with Thinking for a Change. It's not an alcohol and drug treatment program, but it teaches just basic communication skills. I mean, just basic how to have conversation, how to deal with having a disagreement with somebody. And then that's what I think is great about that curriculum because a lot of us, we don't have those basic skills. We don't know how to confront somebody if we're having an issue. We just lash out and let our
Mhm.
emotions dictate our actions, reacting versus responding.
Yes, yes, yes. Which I've let the guys know in my group we're going to do some anger management stuff coming up this coming week, so I'll get into that. Our last
Mhm.
session I did touched on reacting versus respond. I It's amazing because we're talking about this in terms of drug and alcohol treatment, but when I look around in society as a whole, I'm like, there's a lot of people out there right now who need to realize that you're going to have people who disagree with you. Not everybody's going to see the world the same way you do. And I mean, it's CBT, DBT, you hear people bounce those terms around a lot, but I see DBT as an offshoot of CBT. I don't really see it as different as a lot of other people do it. very similar stuff. And when you get into those two areas, I think it's important, like to teach guys acceptance and being able to accept the fact the number of things in the world that you can control is a lot smaller than the number of things that you can.
Yeah, just the other day, I had a individual I was working with was having some issues with somebody else in the facility, and I just kind of talked to her about, is it rational to think that everybody here is going to like you? Are you going to get along with everybody? No. Yeah, we go out there in life, and not everybody's gonna like us. We're not gonna like everybody. But to have that irrational belief that everybody must like me and they should
Yeah,
like
yeah,
me,
yeah.
and it goes right into the rational emotive behavioral therapy put in place by Dr. Albert Ellis, which I know you're a big fan of as well as me.
Yeah, yeah. I think I see him as the foundation of, and
Yeah.
that's one of them. I mean, do you have reasonable expectations? If I question my thinking and ask, is this realistic? Is this rational? Is this a belief that's going to work for me, or is this going to more difficulty than maybe thinking a different way?
Yeah. And I was actually talking to a guy last night, and he was talking about, hey, I want to continue to work on myself. What are some things, is it AA, NA? He was kind of curious. I said, well, I said, AA, NA is not the end all be all. I said, there's other programs out there that you have access to. And the first one I told him about was Smart Recovery.
Your smart
And
recovery, to celebrate recovery. There's a couple of different
yeah,
that are similar but different.
yeah.
Try
And I
one,
talk,
try all. It doesn't, find out what works.
Yeah. And I talk about smart recovery. I said, that's probably gonna line up more with a lot of the stuff that you've been learning while you've been here, because it's rational motive behavioral therapy, REBT, CBT. I mean, it's just that's what it's based off of. So you can learn some of those, those coping skills. Unfortunately, it's not as big as AANA. So like in-person meetings are really kind of hard to come by, but they do offer virtual meetings,
Mhm.
so there's no excuse.
No,
And
because actually a person could do AA and NA in person, and if that was their only choice for doing those, they could do those virtually as well. Doing both is definitely better than doing neither.
and then of course you got Celebrate Recovery, which is a faith-based, Christian-based recovery system. So if that suits your needs, then go for it. Try it out. Figure out what works.
And
And
if us having this podcast, like you say, hopefully people get content because the style is probably not going to win any major awards right now. But listening and they're not aware of those other two support group options, then hey, try them out. They're out there. Find the one that works best for you or a combination thereof.
yeah, like I said, we're not dogging NA or AA. We're just saying there's other options out there. Find what works for you.
That's right. Combine them, whatever. Go to one day, do one virtually the next. There's no such thing as too much support.
Yeah, because it is definitely a hard road. But going back to the study, I actually found that study and dug into it a little bit, and they referenced a study that was done in I think it was the 70s. Stanford. Stanford got away with a lot in the
They
70s
did.
as far.
They did in the 70s. You couldn't do these days. Shoot.
Yeah. So they did. Have you heard of the marshmallow study?
No, actually, I have.
Okay. So what they did is they brought in a bunch of young kids and would give them marshmallows, and they would observe on who could refrain from eating the marshmallow. It's all about delayed gratification. So they studied these kids, and then as they got older, they studied them, and they found out that the kids that could delay gratification, higher test scores, lower alcohol and drug use.
Mhm.
I didn't dive that deep into it, but it was pretty interesting. I could definitely kind of see the connection there. That
That is kind of interesting. I can see where that lends more credence to the idea that there's a physiological, biological part to addiction as well. it's interesting to think that, hey, if I'm a young kid and I'm able to delay gratification with these marshmallows, that means I might be more successful staying clean and sober or not having alcohol problem, drug
Mm.
problem. Interesting.
Yeah, I mean, it's definitely something that I hope to kinda dive more into, and I think they tried to recreate the study, and I think they still kinda came away with the same
And
results. I
that
don't think.
was long ago, right? Because part of me wonders how successful they would be if they had that study with adults these days. We are an instant gratification society, much more so that many decades back.
Oh,
So
yeah.
much stuff instantly available to us.
Oh, yeah, if my Amazon ain't on my door in 2 days, then somebody should pay.
Right. And I want to be able to get on there and track it so that I know when it's 2 stops away from.
It's definitely times have changed, that's for sure. So,
Just before, you know what, that would be an interesting thing to see what we can find research on. In the current society where it's almost instant gratification, is that making it more difficult for people who are like to refrain from drug and alcohol use? And how much more difficult does it make trying to treat drug and alcohol abuse? I mean, in a society where we have instant gratification, it might be more difficult for somebody who's an addict to not seek that. We're all socialized. Think that that's part of life.
oh, yeah, I mean, heck, there's apps where I can have booze delivered to my house. I don't even have to leave my house. And then, and I know that there's apps out there for, the illegal drugs. So
Mhm.
it's definitely more accessible than probably it's ever been.
Yep.
But, I was talking to a guy last night and he was like, "Well, I just need to move here and do this and do that." And I said, "Yeah." I said, "Yeah." I said, "People, places, things, change those. It can definitely help, but wherever you go, there you are." So if you're an addict in Tennessee, you can be an addict in Seattle.
Yeah. Changing people, places, and things is one of those things you hear over and over again. And I probably say that 25 times a week. And it is a valid piece of the puzzle, but it only works if it's part of actually a relapse prevention plan. And if I'm actually going to do other things along with it. And how determined am I to stop using? Because I can change people, places, and things, but guess what? It won't take me long to find out where I can get my substances in a new place if I want them bad enough. So I think it's a huge part of it, but it has to be part of the bigger plan. And it's not as simple as I'm going to move somewhere else.
Yeah. You take an addict and you drop him in any town, any major city, he's gonna find it.
Yep,
He's gonna
that's
find it.
true.
Alright. So any, final statements on the connection between, emotion management and alcohol and drug abuse?
Just that I think once you get into doing this kind of work, and especially I think it's really important in the environment we work in with incarcerated individuals for them to, again, realize that there are coping skills out there, that they aren't powerless, that they can learn ways to control their emotions. And when they get to things like when they get to where they're working on anger and other emotions, and it's very, I have found it to be the ones that have done well in treatment. It's the sense of empowerment that they get from realizing, you know what, I don't have to react, for instance, in the same way, especially in a jail environment, because they have the jail code in there, and if you say certain words, I've been socialized and trained in this environment that I have to respond in a certain way. And if you can get them to buy into the idea that there's a different way to approach it, a lot of these guys come out really feeling like they don't feel as powerless as they did. Unfortunately, it's not as high a percentage as I would like, but the ones that have done really well, they buy into this idea that, hey, there is something different I can try. And I've seen it kind of change their whole view of things. And that's one of the things they'll tell me is now I realize I have the ability, I have options. I don't have to go down same road. I don't have to react the same way. I can respond differently. And that sense of empowerment, I think, is when you see it, And when they grasp that, I think that's one of the best things about the job when you can help them to see that connect because it's hugely important. You know, the idea and I think it starts with motivational interviewing too. I can tell you all day long what your motivation for staying clean and sober, working on your emotion management. I can tell you why you should do that all day long, but you got to find your own motivation. You got to find why. Why do you want to make a change? And when they start to make the connection, they make more progress.
You keep them motivated by external things, other people. You have to figure out what's going to make you make the commitment to being clean and sober.
Hmm.
And the individual that I was talking with, he was like, "Well," he said, "I've got a couple of kids, and I've not been in their lives the majority of their life." He's like, "They're teenagers now." He's like, "I don't expect them to forgive me because majority of my life I was chasing a high." And he's like, "Hey, I'm tired of doing this. I want something different." And I was like, "Hey, man, go for it.
Yeah.
You know, go
Yeah. I
for it."
mean, if he can decide it that way, he's probably in a place where he might actually have. I think external motivation is good if it gets them in the room, if it gets them in the group.
Mhm,
If I'm just want a certificate, I tell them, fine, come on in. Hopefully we can get you that from that. I just want a piece of
mhm,
paper to the point where you're like,
mhm,
maybe I do have an issue, maybe it's something I can learn. So if we can
mhm.
get you in there, we can progress past that. So it's good. If it gets you in there, it's not a bad.
Yep. And like I said, we could definitely make this podcast 5 hours long if we wanted to. But
Yeah, yeah, yeah.
I'm going like I said, we got several years of experience working with people. But yeah,
I'm
so
not even
look,
sure. Yeah, I think we actually veered off a little bit, but that's okay because we have so I mean, it's gonna happen because
yeah.
between the 2 of us, there's lots of years experience there. So
Mhm.
it's when you have these conversations and one person says something that sparks another idea, you're right, go on forever.
Yeah. And this is our first structured podcast. So
Warning.
anyway, yeah,
Yeah.
morning. Yeah. So all right. So if anybody's still listening, then I got another question for you. So, what are your thoughts on virtual versus in-person groups when it comes to alcohol and drug classes? And what's your thoughts on individual alcohol and drug treatment versus group treatment? So it's kind of a two-part of
Mm.
there.
Okay. My personal experience has been positive with virtual thus far. However, there is one caveat to that, which is most of the virtual stuff that we've done is anger management education based stuff. I don't know if I've done, I don't think I've done drug and alcohol groups virtually. I can see where there might be a little bit missing from that because of the group interaction and what the extra stuff that you get by. I think there's more you can pick up from that by actually being in person. And part of the reason I say that is because, like you were talking about communication earlier, and for a lot of the guys in the setting that we're in, the treatment that we talk about communication a lot and how important it is to practice speaking up. Because for guys, especially, we have a lot of difficulty saying, "Hey, I need help." And so, being in that group with peers and pushing yourself to actually speak up and talk about things that you might not be comfortable talking about, I think is a valuable part of the process. And my hope when they start in like the jail setting is if they can open up and get comfortable with it, they might be more willing to keep seeking help on the outside. So I think maybe they wouldn't get that part of it if it was virtual, but for
Mhm,
education stuff, I haven't noticed any difference. If it's an anger management class for a lot of people, I think it actually is easier for them. They don't have to travel. They don't have to be around a lot of other people. They can do it from the comfort of their own home. So I think it helps some people to open up. But for both type groups, I think it sure beats not doing it at all. So the virtual stuff, I don't think it's going to go away, and I'm very okay with doing, particularly
mhm.
for education stuff. I think it works fine. And if you can get somebody to do anger management out in the middle of nowhere and needs it, if they don't have to travel miles to get it, they're more likely to do it. So I think there's benefits and there are downs.
What about somebody if they're looking for alcohol and drug treatment? Just based off of your experience, would you rather try to treat them individually or like in a group? What do you think would be the best?
Ideally in a group. Ideally in a group. I think it would depend, and although I have my master's in mental health counseling, I've been doing the addiction side of things for so long that I have to dig back into the DSM and relearn a lot of stuff. But I know depending on what, like there are certain mental health disorders that would make it not ideal for an individual to be in a group and on the outside. And that's another thing that's tough because when you're working with the incarcerated folk, a lot of times there's not nearly as much screening that goes on. The court says, hey, this person's going to treatment, put them in treatment. On the outside, there would be more screening to make sure that, hey, they're appropriate for a group. But if appropriate, I definitely prefer the group just because they gain as much from seeing other people who are in a similar situation and interacting with those people as they do from anything that I tell them. So, given my choice, if the client is appropriate, I'd rather.
I would definitely agree there because years ago I was at a conference. I think you might have been there, you might not have been there, but one of the speakers, a professor of pharmacology, in I think it was University of Georgia. So he taught pharmacists how to be pharmacists. Very,
Right.
very intelligent guy, and he talked a lot about the different chemicals in the brain and how it interacts with addiction, and I can't remember the specific chemical in our brain, but basically there's a chemical in our brain that allows us to connect to people.
Mhm.
It allows the infant to connect to the mother. And when we're active in addiction, you lose that chemical. So that's why you see a lot of people when they're active in addiction, they kind of remove themselves from people. They don't have that
Yeah.
connection. And he talked a lot about having that group connection allows your body to start producing that chemical again.
I don't know what the chemical is either, but
Yeah, yeah,
I'm sure that's a true thing.
yeah.
I think that's why support groups work. It's I'm not alone in this anymore. I don't know how many times on the sheets that they fill out, that's what, hey, what did you learn today? I learned I'm not alone. That if I had a dime for every time somebody wrote some version of that on that sheet, I have
Mm.
quite a bit of my thankful in the last 8, 9 years.
Yeah, we like to think that our life experiences were unique and nobody's ever done anything that I've done. But in reality, we've all been through it in some shape, form, or fashion.
You don't think anything in common with you is probably relating to you a lot more than you realize.
Yeah. Okay. I pulled this from the SAMHSA anger management manual. I know this is, we're talking about alcohol and drugs, but this is referring to anger management. So it says Moreland, 2010, studied 125 veterans with post traumatic stress disorder, PTSD, and anger control problems from 3 Veterans Health Administration clinical sites and 3 vet centers in Hawaii. Participants were randomly assigned to receive the anger management treatment either in face to face sessions or over video conference equipment. So nowadays, I guess that would be Zoom.
Mhm.
Regardless of mode of presentation, participants reduced their levels of anger significantly, suggesting that people can achieve significant reductions in anger levels using many different modes of presentation. 90% of participants completed their treatment. So there's actually been studies done on that. So, and I wasn't aware of that study until yesterday. But
Well, I'm
like
glad you
you,
found it because it back to what we were just saying. That's all. But we do the virtual anger management classes, and I think they're beneficial. I think you get some people who would rather do it that way than have to travel somewhere.
Mhm.
And especially because we set ours up, you set up times with them where they're as flexible as possible. They don't have to be at a certain place at a certain time. A lot of people don't feel comfortable sharing in groups. So for those people, virtual can be good also. Even though we do have groups, I mean, a lot of people aren't comfortable sitting and talking about, half of them
Mhm.
don't want to admit that they ever had an anger problem. I think anger management virtually work well. I'm glad there's studies out there kind of back. I see it as more important than I do the education part. I can be done well, but and so it doesn't surprise me, and I hope there's like even more research to back it up.
Yeah, and that's what I tell a lot of people is that whether you're struggling with anger issues, stress, anxiety, alcohol and drug dependence, a lot of the stuff that you're going to learn is going to be educational because it is going to be new
Yes.
information. And if you decide to come to us to get some behavioral health education, hey, it's a good starting point, and it might get you started on the path because a lot of people, like you said, don't want to be labeled as, hey, I got an anger problem or I got a drinking problem or whatever.
Yeah.
So you can label it whatever you want to. Emotion management. We all got emotions. Anger is just one of them, and we try to explore that whole area of being able to regulate our emotions because
Mhm.
it's so needed. So,
Like I said, well, you use the way you do when you set up our meetings with people we work with, try to be as flexible as possible so they can be more discreet about it as well. It's not like they have to go to a supervisor and say, hey, I'm going to need Thursday off, Thursday night off, 4 hours so that I can go to anger management for the next 2 months or how many ever hours they got. They can do it. We do it on the weekends, keep it flexible so that unless your job is the one that sent you, they never and that being able to be discreet and be private about stuff is important to some people. Keeps down shame and not everybody needs to know. So I think that that's another thing that being flexible and doing it virtually allows people to do instead of I have to schedule a time to be when it's being taught at a specific facility. And so I think that's a use of it too.
all right. Well, definitely agree. I think that's a good stopping point. Well, if you would like to learn more about our services, please visit our website, freedomanger.com. Shoot me an email. It's the easiest way to get a hold of me. We do free consultations, free assessments. Most people will charge anywhere from $75 to over $100 for just an assessment. We do it for free. You don't have to use our services after that, but hopefully you choose to. Please, if you got a topic you want us to cover, talk about, questions, just shoot me an email. Maybe that'll motivate us to do more of these podcasts. So we got a couple people listening. All righty. Well, thank you, Mr. Jonathan,
That's been nice.
for your wisdom. And until next time, this is the Freedom from Anger podcast.